Welcome back. We are continuing to focus on Heart Month. Recently, I spoke with Dr. Finet all about the importance of getting those screenings and why some people are afraid to be screened, especially when they have a family history of heart disease. Here's more.
The ongoing impact of the pandemic on heart health and healthy habits is quite significant. In fact, the Cleveland Clinic found that worsening mental and physical health is affecting hearts. And here to tell us more about that is Dr. Emanuel Finet, a staff physician in the section of heart failure and transplantation medicine in the Heart, Vascular, and Thoracic Institute at Cleveland Clinic. Dr. Finet, thanks for joining us today.
Thanks for having me.
February is American Hearth Health Month, and according to the Cleveland Clinic's 2022 Heart Health Survey, the pandemic is impacting Americans' heart health and healthy habits, with 2 out of 5 of Americans having experienced at least one heart-related issue since March 2020. What are the ways that living in the pandemic has affected heart health and healthy habits in particular?
Yes, in particular, patients are living less healthier lives compared to before. There's a greater incidence of patients that are actually more sedentary. About 80% of them reported just sitting throughout the day and walking less. There's a poor eating choices. Only 50% of them follow a particular diet, and 50% do not follow any diet. And also there's been a higher level of stress in the population that has been reported. All of those are really have a great impact in our cardiovascular health.
According to the survey, women have felt more stressed than men during the pandemic. How does this increased stress contribute to heart issues? And how do you know if your stress levels are impacting your health?
Yes, stress can definitely contribute through a higher blood pressure, through palpitations and arrhythmias, increased eating leading to obesity, and also it can lead to direct cardiac consequences like heart attacks or a stress-induced heart disease or cardiomyopathy. It's difficult to know unless we measure those consequences by seeing our doctors and getting checked out. I think patients can perceive that they are more nervous. They can have palpitations or maybe heart symptoms like shortness of breath or chest pain. Or they can even have non-cardiac issues like acid reflux, and those things can make us aware that maybe something's going on and we should go to the doctor and be seen.
The survey also found that less than 40% of people with family history of heart disease have ever been screened. Do you think that is because over a third feel that there's nothing they can do to limit the risk of developing the heart condition?
Yeah, that's actually a sad finding. 80 to 90% of cardiovascular disease is preventable by controlling risk factors. And many of the cardiovascular diseases in our family is also preventable because it's not that many times the disease itself what is hereditary, but the risk factors that carry to that disease. So control of such things as blood pressure, blood sugar, cholesterol, eating healthier, weight loss, stop smoking, all those things are vital for us to take hold of this, findings that we have had currently.
What are some preventative steps people can take to prevent heart disease, even those who have a family history of heart disease?
Yeah, first and foremost, those that have family history of heart disease, they need to get screened. They need to go to the primary care physicians or their local cardiologists and be evaluated. And because many of the risk factors that I mentioned before, such as blood pressure or elevated blood sugar called diabetes or high cholesterol, they are silent. And in a second way, they have to make healthier eating habit choices, right? Eating with less sugar, less saturated fats, and more fruits, vegetables, lean meats, nuts, and as well exercising about 150 minutes a day, a week, which is roughly about 30 minutes a day. They need to be doing some degree of aerobic exercise to maintain a good cardiovascular health.
And where can our viewers go for more information?
They can definitely go to our website, clevelandclinic.org/loveyourheart.
Well, thank you so much, Dr. Finet, for joining us today. I really appreciate your insight in the pandemic and developing heart-healthy habits that can benefit many of us. Thanks so much for joining us today.
It's been my pleasure. Thank you, Christine.